Namaste. I am Dr. Rakesh Reddy Boyya, Senior Consultant in Medical and Hemato-Oncology, Apollo Cancer Centres Visakhapatnam. Every year, 4th of February is celebrated as World Cancer Day. This initiative is to spread awareness about the word cancer, the diagnosis called cancer and its implications, and to raise awareness in common people about the many misconceptions that are there in cancer treatment. So today I come forward to you to explain a very simple logic about cancer treatment. Earlier the stage, that is earlier the diagnosis, better is the chance of cure of cancer. It is a very simple logic that everyone needs to understand. Suppose if you have an early stage cancer, you can diagnose it early in early stage, you can cure it better. So how do you identify a cancer early? How to diagnose a cancer early in its early stage? This is the most important thing that enhances the chances of cure. For this, you have to be cognizant of the symptoms that you are facing. Suppose any long-term symptom like any cough for more than 2 weeks, any change in voice, any loss of appetite for more than 2 weeks, any loss of weight for more than 10% of your body weight, any persistent vomitings, persistent blood in any orifices, any persistent fever, all these, any symptom that is persisting for long time is a symptom for cancer. You have to be aware of this. You have to be aware of the risk factors of cancer. Tobacco is a very important risk factor. Alcohol abuse is a very important risk factor. So you have to be aware of the risk factors that are associated with cancer. Suppose if you are a smoker and you have any long-term cough, it is very important for you to reach out to your doctor so that any cancer that might be there growing in the body can be detected at an early stage. No point in wasting time here. You have to also be aware of family history. Certain of cancers, about 10% of cancers are associated with family history of cancer. So these are called hereditary cancers. So if there is a strong family history of cancer, it is very important to reach out to your doctor so that an appropriate test can be done and a risk of cancer can be assessed in you. Okay, and also it is important to be aware of the screening tests that are associated with cancer diagnosis. So what does screening mean? Screening is any test that is done to detect cancer in an early stage. So you have cancer screening tests for cervical cancer, for colon cancer, for prostate cancer, for lung cancer. So these are designed specifically to identify these cancers in a very early stage, so that as I said previously, earlier the stage, better is the chances of cure. So in females you have mammogram of breast that is designed to detect breast cancers early, a pap smear to detect cervical cancers early. For prostate cancer you have serum PSA test to detect prostate cancer early. You have low-dose CT scan of chest in smokers to detect lung cancer. So very important to know that these screening tests are available so that you can make use of them to diagnose your cancers early. So nowadays there is lots of changes in cancer treatment. No longer you need to be worried about the side effects of cancer treatment. Now this is the era of personalized medicine. So even if there is a diagnosis of cancer that has happened yourself or your near and dear, you reach out to a center where all the specialists are available to make the diagnosis, to stage the disease and to offer appropriate treatment on your near and dear one. So nowadays is the era of personalized medicine. So the treatment focus is on the tumor itself rather than the normal tissues. So that is what the science is going forward as, and that is what we are offering here at Apollo Cancer Centres Visakhapatnam. Era of personalized medicine, a center to personalize treatment specifically for the tumor, for the patient, to minimize the side effects, increase the longevity of the patient and potentially cure them also. Thank you.